Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Megan Antonelli, who will be shining a light on the good things happening in digital health.
Hi, everyone. This is Megan Antonelli with Digital Health Talks, and I am thrilled today to have Tom Lawry, AI expert, author, former Microsoft Director of AI in Health and Life Sciences, and he has a new book, Healthcare Nation, and he's going to join us to discuss that book as well as what we can do to, realize value and move this, allow for AI to actually impact and improve healthcare. Hi, Tom. How are you today?
I'm great, Megan. Thanks for having me. Thanks for that great introduction. You did leave out my paper route when I was 14, but that's probably not relevant to this conversation.
Well, it's, if anything, it shows your experience and that you work hard to get there, right? But, I think what I love about your book and kind of how you talk about AI and healthcare in general is it makes it accessible and understandable and really, shows us that it's inevitable, but that we can do some things better. But I think in the book, you talk a lot, having done some escape rooms with my sons, I love the analogy around, that the American healthcare system is like the largest escape room, and we've got to, get out of the maze that it is. But tell us a little bit about that and how you came to kind of write this new book and, your goal in writing it.
It's a book that is my attempt to explain to anyone who's interested, why is it that as Americans, we spend 3 times more per citizen than any other country on the planet. We have some of the most amazing talent in the world. And yet, by all measures, we score dead last as a health system on quality, on access, on effectiveness. And I've spent a lot of time researching and thinking about that. And so, the idea that in many ways, with what I just said, America's healthcare system is the country's largest escape room, where we've taken the most talented people, all of that money, and we've locked talent and money in with all of the consumers in this convoluted system. We just haven't figured out how to escape it. And I look at the convoluted policies and the very wacky ways in which we incent and pay for healthcare. And my premise is, I know we can do better. And this is a book to try and mobilize to get others to be thinking about that and basically finding or sharpening their voice on what we need to do to change.
Yeah. And I love that. And I think, having been part of this dialogue for so many years where we sort of looked to technology to fix healthcare like it would, and whether it was, regulations, the changes in policy, it always came back to this place where like healthcare is so complex. How do we do it? There's so many stakeholders. You can't just take away one, and you can't blame. I mean, that's another thing I like about Healthcare Nation is that you don't really place blame so much as you empower and ask for everyone to come together and fix. But you talk a little bit too about kind of that fatalism, right? Of how do we get out of here? Because you do sort of every time you can, you have this idea, we're going to change it. We're going to make healthcare accessible to all, you hit a roadblock. So talk a little bit about that and then where you see some of those big systemic problems and how, healthcare organizations can get past that kind of fatalistic attitude.
Yeah. I'll have a chapter basically focused on what I call healthcare fatalism, where I believe healthcare today is similar to what the civil rights movement was in the 1960s. We know it's not working. We know it's not only not optimized to take care of most people, it's actually causing harm, particularly for vulnerable populations. So we know all of this. We want to fix it. But many times people have an attitude of, well, what can I do as an individual? Or even what can I do as a doctor or a nurse or a consumer? And part of this is having to really change our thinking and start mobilizing around, if you look back again to the civil rights movement, and I'm looking for what I call that Rosa Parks moment for healthcare, where, everyone knows the story about Rosa Parks refusing to give up her seat on the bus. And I don't believe she woke up that morning and decided to change history. I think she was going about her normal day, but she was just so tired of a system that not only didn't serve her needs, but actually worked against it. And so many people feel the same way about healthcare. I believe the more we all start mobilizing, finding our voice, giving voice to what we think is important, is the first step of any major movement, which I believe healthcare should be. And then we also have to stop doing certain things that I think work against us. And you mentioned it's what I call the blame game, where it's so easy. It makes us feel better if we can blame someone or some organization. And, our elected leaders are famous at fomenting this. So, this month it might be a congressional hearing calling pharma execs on the carpet. And all of a sudden, they're in the hot seat. And next week it's those greedy providers. And the next week it's the payers. And we have to stop blaming. And I just did a talk for the American Telemedicine Association. I heard I shocked some people with what I said, but I reached a point where I put up a slide of 50-year-old Brian Thompson, the former CEO of United Healthcare. And I told the story of here's a guy, 50 years old, prior to his death, 50 years old, two teenage boys, separated from his wife, which shows he's probably as human as the rest of us. And, he was brutally murdered, assassinated on the streets of New York in late December. And my point in saying this is we're pretty sure we know who killed him, but the real question is what killed Brian Thompson? And I believe it's this perpetual blame game of, providers, payers, others, and we have to stop that. Let's agree there are major flaws in what's happening, and I can go into detail on those. But provider orgs, payer orgs are simply taking the very wacky, dysfunctional ways in which they are reimbursed. They have to manage, and they're just trying to do the best with their piece of the puzzle. So it's time to stop blaming and start really looking at what are the fundamental flaws? What are the systemic things causing all of us to go in the wrong direction?
Yeah, no, absolutely. And it's so true. And when all of that happened and you have the sense of, whatever the anger was, and then the way the country responded, it's like, Houston, there's a problem here. We've got, and everybody, because everybody at some point in their lives gets impacted by the problems, right? That we see them. But even when we see them, we often see them only through the lens of which they happened. And therefore, if the if the drug was denied, it might be the pharmaceutical company's fault, or if it's too expensive, or if the claim was denied, it's the pharma. If the care was slow or late or difficult, it was the hospital. And it is the nature of it, and it is the system that in some ways we have built. But as I think very well do in the book, as well as just in general in your talks, is that there is an optimism to it, in that people go into healthcare because in general they're good people. Brian Thompson was a good person, as all people who work in healthcare, I think, are, because if you weren't, you'd work in something else that wasn't. So, trying to help people, it inherently is that, no matter where you are. So when it comes to that, and you talk a little bit about microdosing hope and kind of how we get, people to change and how to kind of collect them, right? But also with AI, because one of the things that I think that I see as the promise of AI is that what it's going to do is make things that aren't possible because the resources aren't there easier. And some of that sort of low-hanging fruit that is difficult to do to help us realize the promise of technology becomes possible with AI. So talk a little bit about that and what you've seen in, having been working in this space for as long as you have.
Well, again, to be clear, anyone who knows me or read any of my books know I'm pretty bullish on done right, and I always emphasize done right versus done wrong. AI has the ability to make healthcare so much better. Having said that, just to be clear, even if, and you and I have talked about this before, even if all of the promises being made about AI in healthcare are to come true, and we know they all won't, but even if they all did, it will make healthcare better but doesn't do anything to address the underlying issues that are driving us in the wrong direction. And we can come back to that. But to your point, we have the ability to use AI, first of all, to take the existing system and make it more efficient. And a lot of that is looking at the old, outdated work processes, engaging those on the front line, doctors, nurses, any knowledge worker. And when you think about it, in any healthcare organization, the majority of people are knowledge workers. So that's where the value of AI comes in. If you're a frontline nurse, if you're, a physician in active practice, you don't need to be an expert at AI, but you are the smartest people to know the starting points to say, where might we apply AI to make something better? And again, it's not about AI. It's about those things that as you're driving home or taking the bus home at night, you're noodling on to say, man, if only we could do this better. That's always the starting point. And it involves those knowledge workers actively engaged in being part of the process. So beyond that, if we look at things like acute care settings, there are many work processes that are already being made better when it comes to clinical decision support, a lot of administrative burdens, even things as simple as getting smarter about alarms in ICU to reduce things like alarm fatigue. We've got lots of good examples. What I'm pushing on, though, is to say, let's go beyond our normal care settings to say, well, how might we apply some of those same things to the broader things like population health? Like, we can come back to this, but, one of the things I read about Healthcare Nation is why is it that, 97% of the $4.7 trillion Americans spend on healthcare, which, by the way, is your money, goes to what I call the break-fix model. Only 3% goes to prevention. So we have a lot of ways to take that 97% of the break-fix model and make it better. But let's start having the deeper conversation of, well, what if we can use AI to do things like, do a better job at prevention, look at things like hot spotting in geographies to say, well, what if I can predict where certain things are going to occur and get out ahead of it to prevent something, to actually allow us to reduce things like people going into the hospital, the radical idea of actually keeping them healthier. And I'll close, I know I'm going on, but I will be working in Singapore in a couple of weeks, where it's a great example where in a country like Singapore, they're very focused in their health model, both payer and provider, on managing health and then having great systems there when someone's sick or ill. And so, for example, here in America, we are a world leader in preventable amputations, mainly because of our inconsistent way of managing diabetes. In Singapore, they're using AI to look at which citizens are either pre-diabetic already or prone to be pre-diabetic. They've got a series of things they're doing with AI and what's known as nudge theory. And they're actually showing in a controlled study of several hundred Singaporeans, they appear to be slowing the growth of pre-diabetic to diabetic, which is a quality win. It's an economic win. When I look at what's happening in America, if all of a sudden I could do that in America, that might put a lot of provider organizations out of business because of the incentives, not that they want, but because the way in which American healthcare works today. So we're seeing the ability of AI to do good across the spectrum. We're seeing other countries that are ahead of America. And it's not because they're better at AI, it's because their incentives are much more aligned than what we have here in America.
You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
It all comes back to, what was the author? There was a Harvard, the incentives in healthcare are misaligned. Forgetting the book, but it was competition in healthcare. It was
exactly.
Michael Porter.
Yeah.
And what do you think? So when it comes to those incentives, and particularly with the makeup we have now of our United States government, and where levers can be placed to change policy and do the right thing, because Singapore is a very different healthcare system. It's smaller, it's closed, all of the things that we are not in some ways. And so how can we, kind of influence change in such a way to kind of get us to that place?
Yeah. Well, I guess three things, Megan. One, when I have these discussions, many times people put up what you just said, and I mean no disrespect, but yeah, Singapore is a smaller country. The government is the payer and the provider. It's what I call a laboratory country. There are far fewer variables. But having said that, I bring that back to healthcare fatalism of, well, let's put all of that aside. We're America. What if we just said they literally, their government, up to their version of a president a few years ago, declared war on diabetes? Well, what if we did the same thing? Forget about the complexities, forget about the payer model, and all of a sudden, what if we said we're going to do a far better job of preventing and managing diabetes, which affects about 12% of the population? We could apply the same things they're doing, the technologies, the programs. That has nothing to do with complexity and everything to do with me on looking at what are our priorities. So I think that'd go a long way. And then finally, the things that I summarize in the book that are holding us back as a country is one, in America, healthcare is not a right. Whatever you believe healthcare to be, legally it's not a right. So 43% of Americans are or underinsured. And when you map that out, it's a horrible situation. Number one reason for bankruptcy in America is not because you go to Vegas, it's because you or someone you love gets sick. I already mentioned it. We've got a break fix model. 97% of all of that money we spend is on taking care of you once you're sick or injured. And then finally, you look at the wacky incentives on how healthcare is paid. And even if you want to do the right thing and manage health, you pretty much only make money, by providing procedures. We pay for every pill and procedure instead of paying for performance of how do we keep populations healthy and make sure there's a good system in place to care for them when they're not. Those are the things that have nothing to do with AI. We can do a lot to optimize these existing systems, but until we start having that conversation and addressing those fundamental issues, the system will get more efficient and still, in my view, over time will fail.
Right. No, I totally. And I think, I hate even saying value-based care aloud, because it's just been said for so long and we never get there. And it's sort of a euphemism for some things and others. And then even, sort of public health, two very good ideas, poorly branded, poorly executed by our country, but also, that's what it comes down to, is changing those incentives. And that's what the attempt has been. Right. And I guess where I remain hopeful is in that place where I think that value-based care has failed, that technology can make some of those things that are easier, more possible, and then move us along. At least that's my hope. And then, to your point around, you mentioned the nurses and, the caregivers, but also, personal accountability and health education, and that prioritization of that is so important, right? I think that wealth is prioritized in this country over health. And at some point, maybe as our parents and ourselves get sicker, we realize in our lives that is not the smartest path.
Yeah. Well, yeah. So I'll riff on something you said earlier. So one of the co-founders of Berkshire Hathaway had this great saying of, show me the incentives and I'll show you the outcomes. And so nothing is more true than when we look at healthcare and the way it's paid for and the way it's incented. So to your point, if you look in real dollars and adjust for the COVID blip, investments in public health is actually going down, even though there are multiple studies that show every dollar invested in public health produces measurable health returns and economic returns. We've been talking about population health forever and value-based care. If you look at percentage of people who are insured in America that have some type of value base, which is to say, providers are incented to keep you healthy, that's a tiny fraction of what happens in America. But imagine if we woke up tomorrow and our talented providers and doctors and nurses and hospitals were all of a sudden incented to say, we will make more money by showing we are keeping a population of people healthy. Somehow we have the ability to unleash the true talent of all of those people. I mean, think about it. Anyone who's listening, you went to medical school, you went to nursing school. Think about that moment where you decided to do what you do today. Now, think about how close you are to that. What if we could create a system that brings us back closer, that restores, your hope, that allows you to do all of those things you set out to do when you decided to be someone who goes into practice? To me, that's possible. To me, that's back to that. Imagine if all of us could somehow say, we've got almost $5 trillion. We decide where that's invested to manage health, to look at how we play to the highest value our talented caregivers who are in very short supply, that we're burning out daily. It's possible. And we just have to start reimagining, rethinking, and then start really having a stronger voice. I am tired of waiting for people inside the Beltway to decide what to do. I mean, look at the last couple of decades. How well has that worked?
Yeah. Not well. And I think in terms of just even, as you said, the kind of moving of the needle of getting people to change and sort of bringing them together. One of the things, I know you speak at a number of conferences. You're very, well connected and sort of, whether they're association meetings or the big, health and hymns and all of that, and seeing all these different groups, right? I mean, and this is as a convener of people myself. And actually, when I started really wanting to create multi-stakeholder events where the health systems, providers, payers, and pharma, it remains my dream, because at the end of the day, they're not.
Hey, let's do something radical. Let's throw in consumers.
And patients are consumers. Absolutely. And, there's to get that to all come together when they do have such different incentives. I've had a few events where it's really worked. But really, you look at health and they're doing, I think, the best job so far, but it really, what they end up having is a lot of innovators and a lot of, people interested in what's being, what they're doing and sort of the investor side, and then a smattering of providers and pharma and health plans, sort of at the CEO level to talk about what's going on, not necessarily at that doer level, right? Whereas if you don't get the doers in the room, that's where you don't get to fix those flawed processes and those things that are the bottlenecks and all of that. So tell me a little bit about your thoughts in, certainly post-pandemic, sort of seeing people come together and the power that has to possibly change and influence. And I do think that back in the day when I started, it was a lot more about regulatory conferences and sort of what was happening in the Beltway that was impacting healthcare. And now it's much more about what's happening in technology that's impacting healthcare that you see happening. So what are your thoughts as you look at as those groups convening?
Wow, there are a lot of things I could talk to on everything you just said, Megan. So let me start with what you said about, I think the pandemic in many ways taught us all a lot. And I write about that in my other book, Hacking Healthcare. Matter of fact, it's the opening chapter. When you look at how the pandemic changed all of us. And if you're a consumer, I think it brought you up close and personal with a lot of things about the value of your health, the value of your family's health, and not just the health, but how it affects everything, your job, your lifestyle, your quest for what's important. So I think we all learned a lot. And we're also kind of going back to the old norm. So I look at things like telemedicine, telehealth has been around for 3 decades. Clinical literature shows it's very efficacious, particularly for certain groups and types of people. Why did it take a pandemic to get us to try it? And now that the pandemic has passed, why are we regressing and seeing, more organizations saying, do we really need to do much of that? So some of it is, challenging all of us to say, what is the right thing to do? Not what is the economically incentivized thing to do. And some of this too is how do we, if you're frustrated, I mean, there's a survey that shows the majority of Americans I mean, it wasn't just the murder of Brian Thompson. It was the reaction on social media, the reaction that continues today when it comes to people championing that event and the person accused of that murder. So what if we could take all of that and start channeling it into positive means where your voice starts mattering? And I believe that's possible. AI is a big tool that comes over the top of all of that. So again, we can make healthcare more efficient across the spectrum with AI, but where the power really comes in, where we create this multiplier effect, is when we stop thinking about our elected and regulatory leaders fixing it. They're not going to. Again, in another presentation, I got to the point where I tend to be ticking people off lately, but I put up a picture after making some points on healthcare's problems of RFK Jr., and I could almost hear the audible gasp from the audience. And my point was, look, let's agree that RFK Jr. is a lightning rod. That's probably the only thing we're going to agree on. But my deeper point is, I really don't care what RFK Jr. thinks. We have ceded, whether it's providers, whether it's consumers, we have ceded too much control by waiting for others to tell us what they think. I really don't care what RFK Jr. thinks. What I care about is what you think, what everyone listening to this thinks. And my whole view and point is, if we can mobilize, or when we mobilize, when enough of us start saying we've had enough, that's when our voice becomes strong. And that's where hopefully we're going to take back the control we've given to these leaders. That's when they'll start listening, when enough of us say we've had enough.
Right. 100%. There's no question. And I think it's, we're the no BS event and platform. So I like to piss people off a little bit too. So it's good to, and it's important, we can't really have the real conversations around healthcare without ruffling a few feathers and it's frustrating. And it's definitely that, I think all of what you said is so important to how these groups can kind of affect change.
Absolutely.
Awesome. Well, thank you so much for joining us, Tom. To our audience, get out there, read Healthcare Nation. It is inspiring, and it provides, that sort of roadmap for, really getting out there and making these changes happen and making it possible. So thanks so much, Tom, for joining us. And thank you, listeners. This is Megan Antonelli signing off.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shahid Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.